I'm washing my hands for hand hygiene today. I do not want to spread any kind of infection to you, so we always wash our hands. All right, my name is Misty White. I'm going to be an RN, and I'm going to be doing your full body assessment today. Is that okay
Sounds
with you?
good.
Okay. It's going to take approximately 15 to 20 minutes, and I'm going to be assessing all of your systems today. Everything that we discussed today is going to be confidential. Is there anything you would like to ask me before we get started?
I have no questions.
All right. Can you tell me your full name
Stephen White,
and the date today?
March 6th,
Okay.
2025.
All right. And what are we doing here today?
Full body assessment.
Yes. All right. Patient's expressions are appropriate to the situation and changes appropriately with the topic being discussed. There is comfortable eye contact. Pace of conversation is moderate, and the stream of talking is fluent. Patient speech is clear and understandable. How are you feeling today?
I feel great.
Patient verbalizes complete thoughts without wandering off topic. No distractibility was noted. Patient can follow a series of directions without difficulty. Can you tell me what time you arrived here today?
I arrived here today about 5:30.
All right. Okay. Can you recall your very first job and briefly explain what your duties were?
I was a clerk at a video store.
All right. Let's see. I'm going to give you 4 words to remember later on in the health assessment. I'm going to ask you to remember them later. I'm going to tell you apple, book, chair, and window. Okay?
Okay.
All right. Now I'm going to assess your heart rate and your blood pressure. All right. I'm going to flip this thing on. This guy right here. Oh, you just sit in there. Okay. So, all right. Okay, I got 130 over 90, which looks like you are sitting at stage 1 hypertension today, which is anything 130 to 139 on the top number and 80 to 89 on the bottom number. Kind of right there on the edge of stage 2 hypertension. But it's not diagnosed with just one blood pressure reading. See, get your heart rate. I got 72 for your heart rate, which is normal. Anything between 60 and 100 is normal. Can you rate your pain today on a scale of 0 to 10? 0 being no pain at all?
No pain at all, 0.
Okay, I'm gonna assess your skin now. Skin is pinkish tan, uniform in color, with no visible lesions or tattoos. Okay. Alright. No tinting observed. It indicates adequate hydration. Let's see. Skin is smooth without tenderness or lumps bilaterally. No excess dryness or moisture is noted. Skin temp is warm and equal bilaterally. Okay, I'm gonna go ahead and assess your head now. The skull is normocephalic, symmetrical, without deformities. Skin is pinkish tan. A few solar litigines are noted on the scalp due to sun exposure. No lesions or excessive moisture is noted. When did you start losing your hair?
When I was about 35.
Okay. Do you shave the sides of your head?
Yes.
Okay. Let's see. Patient appears bald and no parasites are noted. Facial hair is present, evenly distributed, groomed neatly. Facial hair is short and coarse, dark brown and gray in color. Facial skin is pinkish and pinkish tan, which is uniform with the rest of his skin tone. There are a few more solar litigines noted at the temples. No lesions noted. Let's see. Facial features are symmetrical. Let's see, eyes are located in the upper third of the face. The nose is midline. The mouth is located on the lower third of the face. Okay. I'm going to assess your fifth cranial nerve, also called the trigeminal nerve. Okay, I'm going to touch this cotton ball to your face while you have your eyes closed, and I want you to tell me the word now when you feel the touch of the cotton ball touch your face. Can you close your eyes for me?
Now, sorry. Now.
Okay, thank you. Let's see. I'm going to touch your temples right here and down here on your. Can you clench your teeth for me? Okay, again. I'm going to touch your masseter muscle, temporal muscles. Okay. Your muscle contractions are strong bilaterally. Now I'm going to test your seventh cranial nerve, also called the facial nerve. All right, can you smile for me? Can you turn this way for me? Can you smile for me? Okay. Can you lift your eyebrows? You don't have to keep smiling. Can you squeeze your eyes tightly and keep them shut while I try to open them? Okay. Resistance is strong bilaterally. to keep eyelids closed. Facial expressions are symmetrical, no facial drooping noted. I need you to puff out your cheeks for me and hold air in your cheeks. Okay. Air escaped equally on both sides when cheeks were pushed in. All right, let's see. Your nails. Can I look at your nails, please? I'm gonna have you face me this way. Scoot just a little bit. Can you scoot back just a little bit? Okay, thank you. All right. Nails are neatly groomed and trimmed. They are transparent. Cap refill is less than 3 seconds. They're smooth, no brittleness or splitting, and they are uniform thickness. Nail bed is firm to palpation, and no clubbing, and less than a 160-degree angle is noted. Okay. All right. Can I see your toes right quick? All right. Nails again are clean, neat, and groomed. They are transparent, smooth, no abnormalities noted, uniform thickness. Capillary refill is less than 3 seconds bilaterally. All right, I'm gonna go ahead and look at your eyes now. Could you like turn this way? There we go. And let's see. I use my pen light here. Okay. Can you look around the room for me? Okay. Patient maintains a relaxed facial expression while looking around the room. Let's see. All right. Sclera is china white. Eyelashes are everted, evenly distributed on both the upper and lower lids. Eyelid skin is intact, no redness, swelling, or discoloration, or discharge, or lesions are noted. Let's see. Now I'm going to check your second cranial nerve, also called the optic nerve. All right, could you stand up for me? Okay. Now, can you look here at this chart on the wall, which is 20 feet away? It's called a Snellen chart. And I would like for you to cover your right eye.
I don't have my glasses.
Okay, so you typically wear glasses?
Correct.
Okay. Can you cover your right eye and see the largest?
No.
The smallest ones? Can you read the top row?
No.
Okay.
I'm sorry.
Okay.
If I squint now, it looks like a Z and a T.
Actually, that is correct. Yes, with squinting. Okay, could you do the other eye for me?
Yeah, I can make out the Z and the T.
Can you do the next line down, or
No.
any letters? No?
No.
Okay. All right, you can have a seat for me. All right, the first line, your vision without glasses is 2100. So what you can see at 20 feet, someone with normal vision can see at 100 feet. So, okay. Let's see. Okay. All right. see. I need to check your color discrimination. Okay. All right, I have a color discrimination chart here. Could you read the numbers on the top row?
12, 8, 6, 20, 57.
Thank you. Color discrimination is normal. Okay. And you did say earlier that you do wear contacts and glasses,
Yes.
all right, on a daily basis?
Yes.
Okay. If you had reading glasses on trying to do a far vision test, I would have asked you to remove them because they make your distance vision blurry. But it looks like it's pretty blurry all by itself, right? Okay. All right, I'm gonna test the extraocular muscle function around your eye now by using the 6 cardinal fields of gaze. We're gonna test your 3rd cranial nerve, which is the oculomotor nerve, and your 4th cranial nerve, which is the trochlear nerve, and cranial nerve number 6, called the abducens nerve. Can you hold steady for me and follow my pen with only your eyes? Hold your head steady. Okay. Okay. All right. Patient's extraocular muscle function is intact. Eyes move symmetrically and have a full range of motion. No nystagmus or lid lag is noted. All right, I'm going to darken the room right now and assess your pupils. I'm going to need you to look up in this corner behind my right shoulder. Hey, don't look at my light, look at the corner. Sorry. Okay. All right. No opacicities are observed. Pupils appear flat with a round regular shape and even coloration. Pupils constrict to 2 millimeters and dilate to 4 millimeters. Consensual constriction was observed. And pupils are equal round, reactive to light. And now I'm going to check your accommodations or your accommodation. So could you look at my pen and not moving your head? Can you, your eyes follow my pen? Okay. Okay. Both constriction and the convergence of the axis on the eye were noted, which is normal. And if I had an ophthalmoscope, I would use it to enlarge the view of your eye's anterior chamber, which is your lens and the vitreous, altogether called the media, and as well as the internal surface of the retina, referred to as the ocular fundus. It works by shining a light through your pupil, and since your pupil is kind of like a hole, it just illuminates the back of the eye, and you can see all of the inside structures, which is kind of neat. All right, I'm going to go ahead and assess your ears now. All right, can you look at me? Okay, ears are symmetrical, no swelling or thickening noted. Tips of ears are in line with the palpebral fissure. Palpebral fissure. Okay, and let's see, gonna push right here. Okay, any pain? pain right there?
No.
Okay. All right. The skin is uniform in color and warm. A closed piercing is noted on the left lower lobe. No lesions or lumps detected. No tenderness on the tragus or when the pinea is pulled. Let's see. Or on the mastoid processes. Ears are elastic with immediate recoil. I'm going to use this to look inside your ear here. Okay. See this one here? I'm going to walk around on this side. Okay. We do have hair present in the ear canal. There's not, I don't see any human in the ear canal. Let's see. There's no swelling, redness, or foreign bodies. No impacted cerumen is present. Do you currently have trouble hearing?
No.
Okay. I'm going to go ahead and assess your eighth cranial nerve called the vestibulocochlear nerve that is responsible for your balance and your hearing. To do that, I'm going to perform the whispered voice test while I'm standing behind you. So I'm going to have you face the front. Okay, I will test one ear at a time, so I'm going to include one ear, and then I'm going to whisper a word, and then I want you to tell me what you hear. Just repeat what you hear.
Baby.
I'm going to try the next one.
Sausage.
Okay. All right. The auditory evoked response is intact. Patient correctly repeated words whispered. If I had an otoscope to look into your ear, I would hold it upside down and insert the speculum into your ear canal, using the back of my hand to rest on the side of your face. I would use the otoscope to inspect your eardrum, which should be translucent and shiny with a pearly gray color. Okay. I'm going to go ahead and put some gloves on right quick. I'm going to look into your nose. Is that okay with you?
Yes.
All right. Can I get you to turn towards me again? I'm going to get you to scoot your chair back just a little bit this way. Towards the wall. Thank you. All right. Nose is midline on the face. It is symmetrical and proportional with the other facial features. Let me see here. All right. Do you have hair present in both nostrils? No redness, swelling, foreign bodies. No deviation of the septum is noted. No perforation is noted. Mucosal membranes are pinkish, tannish pink. Okay. It is smooth and moist. There is no discharge noted. All right. Okay, I'm going to go ahead and palpate your sinuses. Okay. And do your frontal sinuses. Is there any pain there?
There you go, my eyelashes.
Oh, I'm sorry. Shut
No
your eyes.
pain though.
Okay. My apologies. I'm also going to do under your cheekbones here for your maxillary sinuses. Any pain?
No.
Okay. All right. And no tenderness noted in the frontal or the maxillary sinuses. I'm going to check the patency of your nostrils. by closing one and asking you to sniff through the other. Are you ready?
Yeah.
Okay. All right. Do this. Okay. All right. The nares are patent without obstruction. To assess your first cranial nerve, also called the olfactory nerve, I would have you close your eyes, and then I would hold a familiar smell and do that same procedure again and have you identify the smell, such as like vanilla or an orange or coffee. But we're not going to do that today. But that's
Sounds
how,
good.
okay, so that's how I would assess your first cranial nerve, the olfactory nerve. All right. Now I'm going to use my pen light to shine down into your mouth and inspect your lips and your gums and your teeth. I'm going to go ahead and change my gloves. Okay, and we're going to need some popsicle sticks or tongue depressors. Have you had your tonsils removed?
No.
Okay. Lips are symmetrical, pink in color. They are free of cracking and lesions. They are moist. Okay. All right. Buccal mucosa is moist and smooth. Pen line. It's the last one. Sorry. All right. Can you open your mouth for me? All right. I'm going to press down your tongue. You stick out. There we go. I'm going to press down your tongue. All right. Can you stick out your tongue? All right. Thank you. Okay. Buccal mucosa is uniformly pink, smooth, moist, and there are no lesions present. All teeth are present. They're white and good repair. No dentures or bridges noted. Patient's gingivae are pink in color. Stippled margins of the teeth are tight and well defined. There is no edema. There's no retraction of the gums. There's no bleeding or lesions noted on either the upper or the lower gingiva. Okay. And the hard and soft palate are continuous and smooth without lesions. Hard palate is white with transverse rugae. Soft palate is pinker and smooth. And tonsils are present, and they are a 1+ grade. They are pink in color, no swelling, no exudates are noted. All right. Need you to, so I'm going to grab a different tongue depressor here. Okay. And now, can I look again in your throat? Can you say ah for me?
Ah.
All right. The uvula is present. It is pink in color and midline. It rises and falls in the midline with phonation. Cranial nerve 9, called the glossopharyngeal nerve, and cranial nerve 10 is the vagus nerve. These can be tested by touching the back of your throat with a tongue depressor, which elicits the gag reflex, but I'm not going to do that today. That's just how we would test those nerves. Okay, oh, sorry. Okay, now I'm going to, could you stick out your tongue for me? I'm going to pick it up. I'm going to look at this side. All right. Any soreness?
No.
Okay. Any pain or unusual?
No.
Okay. Can I see your tongue again? Look here, this side here. Okay. All right. Thank you. Patient's dorsal surface of their tongue is pink. There's a slight white coating on the dorsal surface. It is moist and it is roughened with papillae. There are no nodules or ulcerations. The ventral surface, can I see your tongue one more time? The ventral surface is smooth and veins are present. Okay, thank you. And saliva is also present in the mouth. Cranial nerve 12, called the hypoglossal nerve, is tested by sticking out your tongue out. Can you stick your tongue out for me again? Okay. Tongue protrudes midline. AEB is intact. No tremors or deviations to the side are noted. Okay, now I'm going to look at your neck. Okay. Skin is pinkish tan, and it is uniform with the facial skin. Again, there are a few solar lentiginous present due to UV exposure. Okay. Any kind of tenderness around the neck area?
No.
Okay. Facial hair is evenly distributed and shaved on the neck. No excessive moisture or dryness noted. Color of the hair is dark brown and gray in color. No scars or lesions noted. Okay. Can you try to touch your head to your chin to your chest? Okay. All right. Can you turn your head to the left? Okay. Can you turn your head to the right? Okay. And now can you try to touch your left ear to your left shoulder? No, without raising your shoulders. Okay. All right. Can you go the other way? Try to do this one. Okay. All right. When neck is supple, motion is smooth and controlled. The neck is symmetrical with full range of motion. No audible or palpable crepitus. Cranial nerve 9, the spinal accessory nerve, has just been tested. The trapezius and the sternocleidomastoid mastoid muscles are strong. The AEB is intact with strong and equal responses against resistance. Okay. We do have some lymph nodes here that I was going to palpate. Okay. Ocular, posterior, auricular, pre-auricular, jugulo-digastric, the deep cervical, and can you raise your chin for me? And the supraclavicular were not swollen, or were they tender?
No.
Okay. And no lymphadenopathy was noted. No swelling there. Okay. I'm going to palpate your carotid artery on both sides. You can feel it on both sides. Okay. Now I'm going to listen to your carotid artery. Okay. And can you hold your breath for me? Carotid pulses are strong, equal with regular rhythm, and no bruits noted. All right, let's see. Now I'm going to look at your thorax and your lungs. I'm going to look for any kind of lesions or tenderness. And, okay. Would you mind standing up for me? Okay. And push you can sit back down. Okay. All right. No lesions or tenderness noted. No abnormalities. Skin is tannish pink, congruent with the rest of the skin on the body. Spine is midline. The transverse diameter, the anterior posterior to transverse diameter is 1 to 2. All right, could I have you sit on the edge of your chair for me? And then I'm gonna have you turn to the side again. I can see. All right. Can you say 99 for me?
99.
All right. No tactile firmitus is noted. Now I'm going to listen to you. I'm going to listen to your breath sounds. Okay? All right. Can you take a deep breath for me? Can you lean up for me? Thank you. And come on the other side. Sorry. Can you do a deep breath for me? One more time. Again. All right. Sit. All right. Vascular sounds present in the peripheral lung fields, louder on inspiration than expiration. Okay. Now I'm going to listen to the front of your chest. Can you take a deep breath for me through your mouth? Okay. All right. Okay, vascular breath sounds are present in the peripheral lung fields. Lung sounds are clear auscultation and no adventitious sounds were found. Let me check. I'm going to check your skin trigger here. All right. No tinting observed, which indicates adequate hydration. And I would like to talk to you today about breast cancer in men. It does happen. And we ask that you do monthly self breast exams. You would do that by putting your arm over your shoulder, maybe in the shower, and rubbing your breast from the circular motion from the inside out, and looking for any kind of lumps or soreness or any kind of skin changes. If there are any types of change in texture of the skin, if the nipples become inverted or you currently have everted nipples, any kind of pimply type skin on the breast tissue, I would encourage you to go and see your healthcare provider today. All right. Thank you, Mr. White. I appreciate your help.
Thank you.